I'm a chiropractor based in South Wales, in Port Talbot. I've been a chiropractor for 10 years in private practice. I got the phone call, which I'm sure a lot of people can relate to, where a patient rings and says, "Hi, it's me again. I've got, my back's gone and I need you desperately. I need to see you this week." She said she was going away that very weekend. She shows horses and she was desperate. She said, "Kev, I need you to fix me. I need you to fix me." When she came into the clinic, I noticed straight off that there was something a little bit different about her. She was coughing a little bit and she didn't seem too well. The symptoms that she was displaying really didn't make sense. They weren't consistent with a musculoskeletal diagnosis and definitely not consistent with the previous diagnosis. I was getting 2 and 2 and coming up with 6. She told me she was fine and she needed treatment. It's probably quite a familiar story to a lot of practitioners, a lot of clinical practitioners anyway, where we have patients that are quite familiar. She'd almost become my friend. But I stuck to my ground because I still had no sense of the diagnosis essentially that I was looking to treat. I informed her that she was going to have to go to the doctor to get some bloods taken. It was a little bit of a whirlwind scenario thereafter for her. She was quickly referred for MRI. The results came back and they explained that there was heterogeneous signal coming from the spine. She had her bloods taken, electrophoresis, and came back with a diagnosis of cancer, a very aggressive form of cancer that very possibly could have killed this patient in particular within a couple of weeks. She was having a bone marrow transplant relatively quickly straight after that, which the doctor had informed her was life-saving. It's a case of overcoming familiarity to make the most important and best choices for the patient. From an educational standpoint, right the way through chiropractic, we're taught to have patient-centered care, which involves the patient in decision-making. But ultimately, when your clinical expertise and medical understanding pushes you in a direction that makes you act in the best interest of the patient with respect to their safety, I think you always have to act correctly. And there's a lot of things that can guide you. I'm not constantly having my head in a book. I'm not constantly checking every diagnosis and every treatment plan. I think that comes down to clinical experience an awful lot, but it's our duty as regulated healthcare professionals to keep up with the most current evidence, to understand the infrastructures and frameworks that are laid down for us so that we can apply it appropriately to our patients. It's having the knowledge to understand your limitations and the humility to know that we're not going to treat everybody that comes through the door. And in fact, some of the most important decisions we make are the ones where we choose not to treat. To be able to refer, or essentially just to get them on the right path, is really, really important. I knew it was the right thing to do. It didn't feel right when the patient was pushing at me, wanting treatment. To not give in to almost peer pressure and the pressures of the patient. And sticking to my guns is something that I'm really proud of, if I'm honest.